Okay, today we're going to demo the steps for the composite. Okay, notice that our patient is wearing their safety goggles. We have our materials set out already. Okay, of course, the first thing that we would want to do is we're going to hand the dentist the exploring the mouth mirror right across the transfer zone. Okay. And while the dentist is getting that, is looking, today we're going to work on number 8, and it's just a little chip on the incisal. Okay. The assistant would be getting the topical ready. Again, we won't be demoing how to do that today, but just so you know, we'd be getting the topical ready. Thereafter, the dentist we'd leave that on, then we'd rinse it off. Then we would prepare the syringe with the xylocaine, okay, and the dentist would administer the anesthetic, okay. Then after that's done, after the numbing takes effect, the dentist would of course get ready to use a handpiece. In the meantime, we would have, turned off the light and use natural lighting to come up with a match with the patient, okay, off our shade guide. Okay, there's different colors here to indicate the colors of the little carpules that we're going to be using. You want to use natural lighting, okay, or color corrected lights, depending on what your office has. Okay, so in this case we've already picked our composite. It's ready to go. They're still being numbed. So once all that is done, then of course we can turn the light back on. The dentist will get the handpiece. We'll open up the tooth. Okay, so remember to hand it to me.
Yeah.
Okay, good. Okay. The assistant would be suctioning, okay, and keeping the mouth mirrors clear for the dentist, okay, just gently pressing the air, okay. Once that is opened up and, let's see, cleaned out, give a spoon to the dentist. While they're doing that, taking out the decay, we're also suctioning any decay that's coming out. Okay, give this back to the dentist just so they can look to make sure. While we put that away, then we're going to come back and rinse out the smear layer, anything that's there, any debris. Okay. Okay, once the dentist says that's clean and ready to go, the first step that we're going to do is we are going to etch. Okay. Of course, we would have if we needed pumice, then we would have pumiced. Okay. Here's our etch. Okay. I'm just for demoing purposes, I'm going to show you how it comes out here. Okay. You don't need very much. Right, but normally this is something that we would do right over here. Okay. I have our micro disposable brushes here, and puts them on the tip for the dentist. Okay, and we're going to give me the okay, get that. So go ahead. You can go ahead and place it on there. Go ahead and place it. And that's going to stay on there for 15 to 20 seconds. Okay, and the dentist would go ahead and throw that away. Let me go ahead and put that off to the side for me. Then I'd come here. After 15 to 20 seconds, I would rinse and suction 10 to 20 seconds. First, you always want to suction it up first so it doesn't turn into lemonade. And then you would rinse it and suction. Okay, and what you're looking for is a white chalky field. You want it to be very dry. In fact, what we would have done if we needed to was that we would have placed a cotton roll underneath the lip to keep this area really, really dry, because we don't want the lip or anything. So once we etch, we want to keep that area, has to be dry. If it gets wet, we got to start over. The next step is going to be to apply the prime and bond, and this is a 2-in-1. Okay, and you break it, snap it right here. So you place this down and you snap it. It's as easy as that. You snapped it on the hard surface. Okay, it's in black, so that means it's light sensitive, so you've got to hurry. I put some on my disposable brush, give it to my dentist, close it. She applies it, and then she's going to dry for 5 seconds. Okay? And then I'm going to be getting some more. Okay, you can just hand that right there. I'll give her some more. She has to apply the second part. Okay, and then she's going to light cure for 20 seconds. She's going to light cure for 20 seconds. Give that to you there. You want to make sure not to look at the light. Okay?
Yeah.
Okay, and we can pretend that it's been 20 seconds. We can turn it and just press it one more time and it'll turn off. Okay. Okay, in the meantime, we already selected our material. So we have our tip and our extruding gun. You hand the dentist the composite without the tip. Okay, place it in their hand, and then we get our plastic filling instrument with gauze. Okay. Then the dentist hands it back to me in the transfer zone. I give the plastic instrument to the dentist, and I stay here waiting to wipe the instrument. If the dentist needs more, I'm still holding the composite. Okay, they don't need any more, so then I go ahead and retrieve with my pinky. Okay, the dentist then is going to light cure again. Okay, while the dentist is light curing, what I'm going to be getting ready next is going to be the articulating paper, because they'll be checking the bite after. They'll go through and see if they need to adjust anything. If they do, then we have the articulating paper, and they would go tap tap, bite bite. Okay, if it is high, then the dentist would use a handpiece again to definitely bring it down a little bit. At this point, you want to use, since it's just really going to be powder, you would use the low volume to suction, keep the mouth mirror clean. Okay, and then they say it's good. Okay, then the final step here would be to polish. Okay, and this is the polish that we would use. Okay, and this is the latch polishing cup. Okay, two things I want to point out really quick, or three. If this would have been an incisal, mesial, distal, or incisal, we would have used a clear matrix. Okay, the clear strips for that. If it was an incisal one, then we would have used the finishing strips, which you would have brought in right in the middle and brought up. If you don't mind demoing that for me. Okay, if we would have done the incisal. The other part too are these really cool, these are called contact pros. Okay, and notice that they're blue, they're translucent, so that when you light cure, it goes right through there, but this helps keep the contacts between the mesial and the distal. Okay, alright, that concludes. Of course, we would then wipe up, we would wipe down any blue marks, we would remove the cotton, we'd wet it and remove it so it doesn't stay dry, we'd rinse it. Okay, we'd clean up the patient. Again, we give them post instructions, which would be, okay, you're going to be numb for another 2 hours. However, the material that we've used is completely hard, so you're fine. If you find that your bite is off or high, you want to make sure to call us back right away so we can adjust it. Okay. The last thing you would do is take off the apron. Again, you're going to curl it up if any debris fell on it. and then you would cover the tray, and that's it. Thank you.